Okay, so welcome everyone to the Prostate Cancer Lab. I'm very excited about today's session. We have a very special guest, Glenn Sabin, and this is the first session that we've held where the topic was integrative oncology. We're going to look at some alternative medicine, nutrition, complementary or adjunct kinds of approaches to supporting prostate cancer treatment. So I'm very interested in it. And I think this is a really important topic for us to look at because, first of all, if you've had an experience similar to me when I was first diagnosed, the first doctor I consulted was Dr. Google. And of course, what you discover immediately is that there's so much conflicting evidence, conflicting information available. When it comes to integrative oncology or alternative therapies or nutrition or supplements, there's a lot of conflicting information. And so we thought that it would be invaluable to hear from people who are actually applying these strategies with patients. And we're including integrative oncology in the conversation because we think it's essential to keep it on the same level as everything else. There are some people, including our guest today, who have gotten remarkable results by employing these approaches. So we intend for this to be the first in a series of panels and guests to explore this topic. And before I turn it over to Glenn, I just want to talk very briefly about why I think this is so important and what the challenge is for us as patients. First of all, integrative medicine, nutrition, supplements can be extremely beneficial in our treatment. It is a good way to manage the side effects of some of the other medications or treatments that we're on. For example, if you're doing chemo, there are things that can help with supplements and so forth that can help with nausea that are a little bit less potent than the medications that we are often prescribed. It can increase the effectiveness of some of our treatments. For example, there are some supplements that are considered chemosensitizers that have the potential to improve our response to treatment. And then there are complementary or adjunct treatments like the Care Oncology protocol, which is a protocol using off-label drugs. So repurposing drugs that have been used for other diseases to treat cancer. I've been on that protocol for several years. And then also just generally optimizing health, so boosting our immune system, energy, et cetera, et cetera. So there's a lot of benefit to exploring this. The problem that we face as patients is that, as we all know, cancer is a highly complex disease. And so when we look at incorporating some of these options into our personal treatment plans, what you discover is that some things that are good for other cancers may not be good for prostate cancer. Things that may be helpful to prevent prostate cancer are not helpful once you have been diagnosed with cancer or your cancer progresses. There may be differences in what's helpful, whether or not you're hormone sensitive or castrate resistant or metastatic or non-metastatic. So it gets very complicated very quickly. And most of us do not have access to oncologists who are educated in these alternative approaches or who are supportive of these alternative approaches, who are willing, for example, to prescribe even metformin or some other drugs, off-label drugs that have been known to be beneficial for cancer. So it's a very intriguing space with lots of potential to be beneficial for us as patients, but it's a very challenging space. So I am very excited for today's guest. Glenn Sabin is a past board member of the Society for Integrative Oncology. He's an author and a speaker. He wrote the book N of One. He's a respected thought leader who works with passion and dedication to advance the field of integrative oncology. He's an advisor to the network of enigmatic exceptional responders, which is a study led by Harvard's Chair of Biomedical Informatics. And I'm very interested to hear more about that. He's a faculty member at Duke University's Leadership Program in Health and Well-Being, where he presents a course on health and well-being thought leadership. And there's a short video that I'm going to play to introduce Glenn, and then I'll turn it over to Glenn. And I think we'll have a pretty lively conversation today. So just 1 second while I share my screen. And
I was with my family, my entire nuclear family in Linda. Here I was, 28 years young when I was diagnosed with chronic lymphocytic leukemia, an incurable cancer, an incurable leukemia.
I remember getting a phone call from him. He was crying, which makes me want to cry. And he said, I'm going to die.
My primary care physician contacted my father, who was also his patient, and told him Glenn has chronic lymphocytic leukemia, and I would give him about 6 months to live.
So Glenn was a young man, and he showed up, and he was absolutely angry. And he didn't want to believe that at his age, this was a death sentence.
I knew that I wasn't going to just watch and wait, and I wanted to be more involved in my own self-care. So I went on a journey to learn as much as I could about the things I might incorporate in my lifestyle to create, overall the healthiest person that I could be, who happened to have a diagnosis of chronic lymphocytic leukemia. In the summer of 2003, for the first time, I started to feel the full force and effect of the leukemia.
His disease had gone wrongly. He had been seen at Hopkins, and they told him the same. I said, Glenn, sometimes we have to play medicine. He actually said no. He said no. And then he decided that he would come to me not as a treater, but as a credible assessment.
I just had this little experiment going. I was this, N of 1. I really wanted to test my body and my mind to see how could I impact where I was at.
He's asked me to write things. I said, no, Glenn, I didn't do any science. I can attest to one thing. What you say about yourself and the stage of your disease is absolutely correct. The second thing I can attest to is you did it your way.
Start to be a significant change in my blood chemistry to a point where the blood counts were completely normal.
Glenn is the most extreme type of patient who basically decided he's going to engineer his own solution. Can you spontaneously remit to chronic lymphocytic leukemia? The book says no. Whatever magic he did, his disease disappeared. So every time I've staged his disease, it got better every time.
7 years since I was able to clear my marrow of leukemic cells, so a complete and durable remission. The idea is to become the most inhospitable host to cancer possible, and you do that by strengthening your immune function. You do that by working on getting into the strongest emotional shape that you can be in, and utilizing nutrition and physical activity and clean hydration and restorative deep sleep.
For me, the lesson that I learned is anything's possible.
We don't take anything for granted. We're grateful that we continue living a healthy lifestyle that hopefully, keep me in a good place for a long time.
okay, I'll turn it over to you, Glenn.
Well, thank you for that wonderful invitation, Robert. And I appreciate the opportunity to speak with everybody today. I will say that, if today I was as sick as I was back in 2003, that I would not have refused standard of care, because standard of care then was palliative, and if I had gone with an experimental bone marrow transplant, or even the standard of care with the 3 chemotherapeutic agents, that I wouldn't be with you folks today. today we have wonderful targeted therapies, and it's getting to a point where there's like a functional cure for chronic lymphocytic leukemia. And it's come a long way. All this advancement has been in the last 7 to 8 years. So that's a huge change, because I was awfully sick back when I kind of extended my little informal experiment. I'll also say that that at its core, integrative oncology really focuses on, and not unlike functional medicine or lifestyle medicine, it focuses on lifestyle factors. That's where the literature lives. That's where it's growing fairly rapidly. So 30 years ago, there was no such thing as integrative oncology or even integrative medicine. And so there's been a lot of change over these last a few decades. But at its core, and what we'll all see if we go to the NCI site, American Cancer Society site, is related to prevention anyway. That it's important to focus on, and the literature supports eating well, sleeping well, moving your body, and so forth. Those core fundamental aspects of those lifestyle factors or lifestyle medicine certainly helps to strengthen immune function, to make us more resilient. Over the years, I talk a lot about the host versus tumor, and it's really should be host and tumor. And so when all these therapies are directed to the tumor burden, and there's not enough attention that goes to the host environment, that's half of what we need to look at. That's often missing. It's not what type of cancer does a person have, but what type of person is it that has this particular malignancy. That's just as critical. And so a evidence-based or evidence-informed approach to care that focuses on the host environment, the emotional state, and a lot of different factors that support immune function. That's critical in my mind. Of course, I could correlate that to these couple, fairly remarkable clinical responses that I've had, over time. At the same time, integrative oncology is evidence-based, if not evidence-informed, and it shouldn't be confused with, alternative medicine, alternatives in lieu of standard of care. Now, I'm a walking contradiction, because I refused a standard of care. I earlier expressed why that was, that I refused the standard of care. But at its best, integrative oncology combines, from my perspective, it would be the best of precision medicine or precision oncology with evidence-based or evidence-informed integrative oncology. In my view is that if something is safe, if there's no known contraindications, if it's potentially efficacious, because there's varying levels of literature that supports all these different interventions that are available, and if someone can afford them, and if someone is able to track closely how they're doing, so they can measure to some extent what they're doing versus how it may be changing their outcomes, then I think that's a good place to be, and it's worthwhile to try some of these things. Beyond the core lifestyle stuff, when we talk about supplementation or even things like high dose, vitamin C, or a number of other interventions that are available today. So I can, I'd love to hear from everyone else, and happy to answer any questions in any particular area that I might, provide input on.
Thanks, Glenn. I have a question about, Brad actually sent me a link literally just before we got on the call, so I barely had a chance to look at it. I'll put it in the chat, but it's some research about diet and the impact on prostate cancer progression. And I just I just put the link in the chat. It's an abstract, so there's not a lot of information there, but
Right.
I'm curious if you would just talk about diet in your video clip. You know, we see some little cutaways of you making making salad and everything else. What's your take on how valuable diet is with cancer? And, you know, again, knowing that one of the things that complicates this is that not all cancers are alike, not all prostate cancers are alike.
Sure.
But what's your take on that for cancer in particular?
You know, I believe strongly that nutrition and diet is a core determinant of health. You know, it shouldn't be siloed. There's other lifestyle factors that are quite powerful as well. But diet, and from my standpoint, is the most critical core determinant of health. And so I've had the same diet for 30 years. It's maybe closest to pescatarian or Mediterranean, in that I eat an abundance of rainbow of plants. And I eat cold water omega-rich fish, and that's the only animal protein that I eat. And all the fish, you know, basically is salmon, halibut, cod, sardines, mackerel, high omega-3 cold water fish that's sourced well. That's been my diet, you know, over all these years. Now, the nutrition science has really evolved, and we're going to get to a point soon enough where there's going to be very specific diets that are tailored to underlying pathology, as well as the various agents that someone may be undergoing in terms of their treatment schema. Robert, you had mentioned about integrative oncology or lifestyle factors that could perhaps modulate or potentiate you know, active therapy, and also help reduce the deleterious side effects of some of these stronger, you know, anti-cancer agents. And that's what we've been seeing for quite a few years now. And although there's more money that's being put toward, especially through NCI, for the study of integrative oncology, unfortunately, you know, without real commercial investment, these areas tend to be, you know, low margin areas for commercialization. And so there's not a whole lot of incentive there for companies to, you know, work on new patents for broccoli, or, you know, rigorous cardio and that sort of thing. So, you know, but at the end of the day, any physician, whether they're trained in you know, conventionally, or they have some interest, or they do it for themselves, various, you know, they're living a clean life, they're adhering themselves to core tenets of lifestyle medicine to help support their own careers and their bodies and their minds and that sort of thing. You know, no physician should dissuade patients from eating more healthfully to keep at a lean, or, you know, a proper weight, knowing that obesity feeds many types of underlying malignant disease. So moving your body, good sleep hygiene, good clean hydration, being aware of environmental impacts, both in your home and outside of your home. You know, these are all things that are sensible, and this kind of so-called anti-cancer lifestyle is one and the same that would help position one's immune function and, you know, position somebody to be their most resilient self, to also be an obesity kind of program, or anti-diabetes or hypertension, or it's the same core tenets. So it makes sense any way you kind of look at it.
Just to share a little bit of my patient journey, I was probably on the prostate cancer creation diet for decades.
Yeah.
I used to eat 3 eggs every morning for breakfast, chicken a lot of times for dinner, lots of dairy, and all of that. I thought I was eating healthy because it was organic or free range or whatever. But then when I got cancer, I discovered that all of those things increase your risk of getting prostate cancer in particular.
Yes.
So diet, I'm definitely convinced that diet plays a huge role.
Wow. I want to learn more from you because I eat eggs and chicken, and I think I'm doing good.
Yeah, eggs with prostate cancers, whole eggs especially, is not the best thing. And they studied various agents. Some are very similar in terms of correlating with potential positive impact on CLL, like broccoli, pomegranate, turmeric, green tea. These are all agents that are looked at amongst others for those, hosting prostate cancer.
I'm sorry. What are you saying, that they're good or bad for prostate cancer?
No, that they correlate with having a positive impact. That you should try to fit these things in your diet. A diet first approach to get that bioavailability with clean whole foods, and then supplement as necessary, ideally under the guidance of an integrative oncology trained person. There's a few urologists out there that have special training. So I'm a diet first person. I do take quite a few supplements, but not like when I had active evidence of disease. I was consuming a lot more, but it was informed through blood. And it was informed by a number of, markers. We looked at we looked at nutrient levels, oxidative stress, free radicals, circulation, glucose levels, all sorts of things to inform foods and targeted supplementation. And then that would be titrated over time by retesting and having these labs repeated every 6 months or so. But I personally, there's been no evidence of disease in my marrow for going on 11 years. And I still haven't changed anything that I do in terms of how I live, only because, it correlates with some positive clinical impacts, one, and then two, I feel really good, at 59 years old. I feel really good. So why would I change anything that I've been doing if it's just kind of the way I'm hardwired this way? So.
Glenn, you talk about essentially a Mediterranean diet has worked for you. I'm curious what you think of, say, keto, in particular for prostate cancer. There's some debate about prostate cancer. Again, it progresses if you are hormone sensitive, then keto is supposedly not a good idea. But when you become castrate resistant, keto may be a good idea. Do you have a take on that?
I don't have any specific expertise and or knowledge in keto, although I do follow the literature. I will say that if I were to approach keto, it would be a healthy keto, because there's a lot of unhealthy aspects to keto that could be done and still fit within that keto bucket. But by changing certain things, that would make it more healthy. So both keto and intermittent fasting and fast mimicking diets, these are all things that I follow very closely because they're quite intriguing, especially around GBM and other diseases. And but I will say that for 4 years I've been doing intermittent fasting, 16 to 18 hour fast. Now I started doing that purely for body composition. to just stay as lean as I can be. And that worked for a while. And then all those positive effects kind of melted away. But then, I feel really good even from intermittent fasting. I drink 40 ounces of tea that actually include turmeric, reishi mushroom, and green tea, curcumin, green tea, turmeric, and reishi mushroom, and that kind of helps stunt my appetite. But I wasn't doing it, or haven't been doing it, for any underlying malignancy. It's just that it helped me. It helps my cognition and energy and other things that I notice by doing the intermittent fast. But I find it very intriguing as it relates to intermittent fasting and fast mimicking diets, as it correlates with active treatment and keeping that digestion less busy, and conceivably just getting these agents in your body with less impediments, if you will, while moving your body. So increasing your circulation and getting, any kind of therapy more evenly distributed systemically.
So I just want to note that many of the things that Glenn has mentioned, reishi, curcumin, turmeric, to my knowledge, and caveat, I'm not making a recommendation, do your own research, but to my knowledge, those things are also beneficial in prostate cancer. I take many of those things as well.
It's interesting how some of the same agents kind of connect with or correlate with, prostate disease. I mean, prostate, colorectal, and certain breast disease, they're known to be some of the top, lifestyle driven diseases. And so it would only, make sense to leverage lifestyle regardless of, the tumor burden. And as long as you have clearance to do these things, if it's safe and there's no contraindications and you've been cleared for it, and it's not onerous in terms of working these things into your, daily lives, I see very little downside from, strengthening your immune function and becoming your most resilient self.
You'll have to everybody will have to do their own research and talk to whoever you talk to for advice or recommendations, but I am putting in the chat a link that I found very useful for checking interactions. So if you are going to use supplements, if you are on medication, for example, I'm on Rubraca now, and so I use this site Drug Bank to check for interactions with other supplements or off-label drugs that I take.
There's two resources that I can recommend. One is on my website. You'll have to go into the hamburger menu, and you'll see a national directory of integrative oncology providers for North America. Also, there's another source for herbs, drugs, interactions, and that would be Sloan Kettering. They probably have the preeminent kind of database on this topic. It's quite helpful. Yeah.
Okay. I put the link to your site in the chat. I'm also going to put a link to a book called How to Starve Cancer, which I've found to be a pretty useful resource. A little bit difficult for a lay person, but there's some good information in there. Glenn, I'm curious, you are a cancer coach.
Yes.
And I'm very interested. I'm an executive coach. I'm very interested in what is a cancer coach.
Yeah. Well, about 20 years ago, the gentleman you saw in the video, Lee Nadler, started informally sending his patients to me. And when my book came out, actually a little bit before my book came out, I kind of formalized the coaching that I was doing, and it had been all pro bono up to that point. And I figured, well, if so many folks are kind of reaching out to me to do the cancer coaching, but I'm still, working for a living, that I thought I would formalize it and make it even more comprehensive. And so my coaching covers a deep intake, looking at all aspect of lifestyle, as well as the underlying pathology as well. I try to connect folks on the conventional side with the very best specialists for their particular disease. I always make sure that they are with one or more academic experts that live, breathe, their particular kind of situation. And of course, I wouldn't be part of this community here if I didn't have an affinity for precision medicine. And so I'm a big advocate for looking at NCCN guidelines, but then also looking more deeply about every possible opportunity, especially for advanced stage disease, to make sure that a person has the support they need to look at everything that they should be looking at, that doesn't typically just rolling out of the mouth of their oncologist. So especially when it can limit the the revenue or the comfort zone of a oncologist, because all this precision approaches to assays and how it potentially informs treatment. And once you get off that fairly straightforward approach to managing and treating disease, it's harder to navigate, as I'm sure you all know. And so I look at the future of truly comprehensive precision medicine or precision oncology to include precision integrative oncology at the host level, and also obviously on the conventional side of things, as this kind of precision medicine has been moving apace, if that makes sense. I see them right now on parallel tracks, but I do see this intersection where we treat everybody. At some point, we treat everybody at the bedside, and they have a customized set of agents to focus on the tumor burden, and then also on the personalized kind of integrative side. That's the future that I see. I just don't know how far down the road it is.
I put a link to your book also in the chat. Glenn wrote a book, N of One.
Thank you.
I'm curious, did you in any of your either in your self-treatment or in your coaching, have you worked at all with repurposed drugs or off-label drugs?
Yes, and I think they're very important to look at, but I'm just not a proponent of a one-size-fits-all approach, a la care oncology. I don't believe that everyone that's hosting an underlying malignancy should be on some level of dosing of X agents, be that 4 or 6 or what have you. I think that when it's more informed, then it's a potentially better approach. In care oncology, they're not the only ones with a set of agents that they include for all those that are hosting various types of liquid and solid tumors.
Mm-hmm. Are there other things that you know of for prostate cancer, or do you have are there things that we should look into that you're aware of? Or
as far as repurposed drugs?
Yeah.
I just think that if you're looking at repurposed drugs, then you should look at someone like Will LaValle, who has a much more comprehensive approach to repurposed drugs. Keith Block also does some work with repurposed drugs. Yeah, and it's a lot to to navigate, because you could conceivably have a layer of FDA approved or experimental anti-cancer agents specific to the disease burden. You could have another layer of targeted supplementation that may or may not fall within the bucket of repurposed drugs, because these agents are drugs. These herbs in clinical dosing are drugs. and a lot of them are undergoing, reformulations and testing to become, FDA approved drugs. It's just a very expensive process. And then you have all these cancer supportive drugs to get through the treatment and to help with the side effects and that sort of thing. So it's a lot to, it's just a lot to navigate, as I'm sure you all are already aware. There's nothing easy about this. It's easy to sit in front of a oncologist that's behind a computer that's looking at NCCN guidelines. They'd say, here are the 2 or 3 options for, for the initial disease, and with recurrence, now we're at recurrence, and now we do this, and on the 3rd time around we're over here, and here's some options. But it's much harder, as you guys know, to look at every viable clinical trial, every potential off-label agent, and follow the literature, and it just gets so complicated so quickly.
Yeah. I also put a link in the chat, which is the Redo Drug Repurposing Database, which has some, some information about repurposed drugs for cancer. One of the challenges for us as patients is that a lot of this information is, speaking for myself, is over my head. I don't really know how to interpret a lot of this. And the other thing is, it's incredibly difficult to find an oncologist who is willing to sort of support the use of this. I was in a clinical trial which involved immunotherapy, pembrolizumab. And to enroll in the clinical trial, I had to sign like a 20-page document about all of the potential side effects and risks, including death. But I asked my oncologist for a prescription for metformin, and he said no.
Yeah.
So, it's unfortunate that most of us are treated by oncologists who do not have the openness to consider, even when there's good evidence, which I think there is for metformin, some good evidence that it has some value in prostate cancer.
Yeah.
But it's difficult to find practitioners.
It is.
When you're doing your coaching, how do you address that issue if there are complementary things or changes that require a doctor's approval to incorporate into your treatment?
Well, yeah. Well, complementary therapies or more supplementation, botanicals, et cetera, that's just a matter of, if you're comfortable with the prescriber of the supplementation, and you've looked at and this person should obviously be acutely aware of any kind of contraindications as well as potential efficacy, then it's just a matter of, who are you going to take lead from on that? This integrative provider or your treating oncologist who likely doesn't know anything about that. When it comes to off-label drugs, when it comes to anti-cancer agents that aren't FDA approved for that particular indication, or other pharma-based agents, with these providers, there's a couple of issues. One is the economics of a patient that requires more energy and time and is seeking care, for a 2nd line, a 3rd line, or whatever, that doesn't fit well within their bucket and comfort level. Then you have all the potential legal exposure and that sort of thing. So it is difficult when, I was able to get someone through Georgetown Lombardi. I was able to get someone, onto Enhertu before Enhertu was approved for low amplification, HER2 breast cancer. But by the time I was able to achieve that within 2 or 3 weeks because of an ASCO presentation that just blew the doors off, it was quickly approved within weeks anyway. Don Lemon is involved at some level with this group and with Brad, and working with the gentleman at Moffitt.
Gattenby.
Who's that?
Gattenby.
There you go.
Yeah.
Gattenby. and she is actually working with folks to prescribe off-label agents as appropriate. And she's able to, by working with, she's in Oregon. And so I know she's licensed in Oregon, she's licensed in New York, she used to be at Sloan Kettering. And so
In
it's
California.
you know,
California.
yes, California, Oregon, and New York. And so, you know, she's somebody then that, you know, I would feel I have confidence in, not just because she worked with me on my book and she co-wrote my book, but I've known her for a number of years, and she's highly, you know, highly trained. She's a integrative oncologist. She's, you know, an oncologist, Stanford trained. You know, she's really solid. And I think there are those. I'm hopeful that there are others within, you know, at an academic institution and or within community practice that if you show them, you know, if you discuss the literature, you discuss the opportunity, you push them to do more, you know, I'm hopeful that exceptions can be made. If you have a late stage, you know, considered incurable kind of situation, and you're being recommended treatments that have been proven not to be curative, they may be great targeted agents that potentially have a good impact, and that's great. But if there's already kind of proof that they're not curative agents, you have advanced disease, then you don't really have much to lose by looking at any of these kind of, you know, approaches. That's the way I look at it, and that's the way it's explained to me by oncologists when communicating with treating oncologists that are hesitant to try something different.
Mhm. I think, you know, as patients, I think we all have a responsibility to be advocates for our own care, but also to just advocate for more openness on the part of our oncologists so that it benefits other patients as well. Like, I will say that I'm very fortunate now. I have an oncologist who, if I bring him an idea or something that I've seen in the research, or, you know, I subscribe to prostate cancer, you know, newsletters, and I get the latest information. If I ask him about something, he's pretty open and will research it, and then he'll tell me either no, he doesn't feel comfortable, or yes, he's willing to try something. So
Communication is
Glenn,
king.
yeah, Glenn, you have mentioned several people and resources. Just will you be sure to give Brad that information so he can include all of that in the show notes, because you mentioned a number of things that I think would be helpful for us.
Yeah, no, absolutely. I think that you shared a few links, but and most of you are familiar with William LaValle. But I mentioned three names: Keith Block, who's considered like a father of integrative oncology, Dawn Lamont, and then William LaValle. But I can, you know, shoot over some URLs to those sites, whatever.
I'm putting one more. Sorry, I'm putting one more link in here, and this is the link to your medical case, which I think is very interesting. People may want to check that out.
Yeah. And I'm Glenn at glensabin.com if, you know, anyone wants to reach out.
Robert, I wanted to go back to supplements for a sec. Could I ask a question?
Sure.
So Glenn, you made, obviously you've used a fair amount of supplements. I haven't had a need until now, and I will admit I've had a huge bias against supplements, not because I don't think there's any that work, but because of the whole multi-level marketing industry. And so I sort of got to a point that I wasn't going to take anything just before I got cancer until my doc told me to, because if I just start taking a bunch of multivitamins and stuff and I don't know why I'm taking them, like why? So what's happened in my situation, my oncologist is open to a lot of things, but it's like she's not an expert at any of it.
Sure.
And she's a researcher and all that. So I've had great experience the last 6 or 8 months with a palliative care person who's revolutionized my whole approach to pain and constipation. and it opened my eyes to how my team needs to be bigger. So I have a nutritionist now, and it's not that I don't know what to do. I just don't like to do it at times. But, I'm reasonably healthy with much room to grow. But I went through where I had a recent disappointment, and it relates to supplements. So I want you to comment on my strategy that I'm going to try and or redirect me. My palliative care person hit a wall, and I was getting a lot of neuropathy through this clinical trial I was in. In fact, it was one of the side effects that if it had gotten worse, they boot you out of the trial. I'm out of the trial for other reasons now, but I should have, I know there's things out there that I could have been doing around the neuropathy. So I just use the neuropathy as a symbol now, knowing, and my doc just said, anything else you do, I'm all for supplements, just don't start doing them. If you get led to something, please show me so I can sort of okay it or not. And if she didn't okay it, I think now I would push more. But the person I'm trying to add to the team is a naturopath, but trying to get a naturopath might have some cancer background interest. So when you did all your supplements, and I know you're smarter than I am in all this, but like, how did you decide what might be helpful? You didn't just go to GNC and start pulling stuff off the shelf.
Okay, so you mentioned a few things. I'm going to try to take them in some sort of order.
Okay.
You should always look for like practitioner level or professional level brands. You shouldn't be buying them from big box stores. You want to make sure that whatever is in the bottle is actually in the bottle, and that it's clean, it's been tested, and it's USP certified, and GCMP and all those different acronyms. So you definitely want to look to do that. As far as a naturopathic physician, you want to look for a FABNO certified practitioner. I think it's FABNO, FABNO.org, I believe is the website. You'll see a database with a national database of FABNO. They're essentially kind of oncology certified naturopathic physicians. I'm a big fan of informed, well-placed supplementation. I'm not a big fan of expensive pee. And so you should ideally work with somebody who has experience with oncology and supplementation, whether that's a functional medicine practitioner or an integrative oncology expert that's working with folks hosting various types of malignancies. And it should be a combination of foods and select supplementation. And it's nice when it's informed based on, nutrient levels and a bunch of different markers like those that I had mentioned earlier.
Okay.
Yeah.
Yeah, I got some input on that as well. And it kind of goes back to when Glenn was first talking about keto, and he said you got to do healthy keto. My mom wound up being gluten-free like 25 years ago, and then you couldn't find gluten-free food. You really had to know what you were doing. And my wife and daughter are both gluten-free now. I've been gluten-free for over 10 years. Gluten-free is the same thing with keto. There's plenty of gluten-free food out there that just is bad food, because what they'll do is they'll add more sugar to make up for the lack of gluten and give it taste. So you got to really look at the ingredients. And we run panels for a couple of different groups that are doing holistic medicine, integrative medicine. So we run metabolomics and methylation panels, specifically looking at vitamins and minerals that your body's lacking or has too much of. And I can send you information. I'm not going to recommend one or the other of these companies that are in the panel, but if depending on who it is, this is a small group. If you want me to, I can literally run the panel for you guys, because it's a $200 panel, but we can do it at cost. I can just do it. I can stick it in with one of our other runs. At least you can go back and look up everything that you're deficient on, or you've got and what it does is it's an NGS panel. So it'll show you where you have a variant. And the difficulty with methylation is you don't know if that's been triggered or not, but you can tell by your symptoms whether it's triggered. So it's not like you got to go and get a definitive RNA-seq. You can tell, yeah, I'm definitely feeling this issue, but it gives you a better idea what you want. And like Glenn said, everything he goes through, I'm like, yeah, these are definitely good for not only for specific cancers, but for your health overall. And with turmeric, I never get enough turmeric, but I take a supplement, turmeric, which it's basically non-inflammatory core of turmeric. And all my supplements are non-corn based, non-GMO, no artificial ingredients. And you really got to look at the labels because, I mean, Glenn hit it on the head. All these big these big box brands, they've got all sorts of weird stuff in there that you're like, what the hell is this doing in a supplement? And there's, if you have any questions, just bring them up because I can tell you right off the bat, there's certain names you're gonna drop, and you will feel a difference. And what you got to realize is your body's gonna absorb this at some point. It's gonna change again. So the supplements you take today, you may not take in 3 months. Right. It's just like your diet. You got to monitor it. But John, I think everything Glenn's saying, I'm agreeing with. But if you guys want, I can give you names like Saber Sciences is a lab in Carlsbad. Epigenetics RX is a lab down in San Diego. And Epigenetics RX does this testing for like 2,400 holistic integrative medicine doctors. So whether they're holistic, whatever you want to call them, but it's worth looking at. And I can send you some of their literature. I'll get you the webpage. I'll send it over to Brad and get it sent out to everybody. But
Thank you.
If anyone's interested, you got my contact.
Yeah. So can you just say a little bit more about the panel you said that you can do?
Yeah. So we do a panel. It's a panel that we customized for this group Epigenetics RX because they came back and it said, here's the SNPs, the 49 SNPs that we test. Can you guys do a panel? So we did a panel. It's like 89 SNPs specific to methylation and metabolomics.
Do people even know what a SNP is here? Does everyone know?
Okay, so it's so when you look at within certain genes, the RS numbers are your SNP. So it's like biomarkers would be the best way to describe this. So you're looking at
it means single nucleotide polymorphisms.
I was going to say, Rick, I can get into the science, but
well, I think you gotta. People don't know, so it's
no. You're right, and I'm going to say,
I'll let you go.
Single nucleotide polymorphism, and it'll be okay. SNPs easier. It's still Chinese.
They don't know what it means.
I'm just going to jump in here because we only have a few minutes left, and Eric has had his hand up. I think we have time for one more question. Eric, if you want to go ahead.
Yeah, thanks. So my first question is, John, how do I connect with you more? Because I want to do this. I don't know if there's a contact you could put in the chat here or something.
Yeah, I'll put that in the chat. And the nice thing with EpiRx is they hook you up with a doctor too, and you can do a telephone consult with a holistic doctor.
Okay. Right. My second question was, Glenn, you were talking a lot about physical changes, diet and supplement that you've done and had experience with. I guess my question is around, in addition to that, I'm doing a lot of those things already myself. I switched to vegan. I'm taking a number of supplements, mushrooms and stuff that I just put in the chat. My question is, I guess, around other lifestyle things like maybe mental or emotional or spiritual things that you've done that you feel fit into boosting this immune system, kind of in this integrative manner. Yeah, acupuncture, like sauna treatments, these kind of things that aren't just like physical diet things.
Sure, that's a good question, and it's an important piece of this. And I've written fairly extensively about this, and that there's not one way to go about, reducing stress, and everyone has a different approach to, what they call meditating. And that sort of thing. So I never became, unfortunately, a deep meditator. I guess I'm just not wired for that, unfortunately. So yeah, but I keep my stress level down by mostly my lifestyle and you know, I not being around crazy things and crazy people that you know, don't kind of feed into that box I'm trying to live in. But you know, I go about it through exercise is very relaxing for me, even though I'm moving my body. So I could be in a hot tub. I can be, I mean, I'm a proponent of acupuncture for sure. I could be in a hot tub, a hammock. I could be walking, swimming, you know, all these things to me, even though I'm moving, I'm not sitting, you know, listening to my breath and sending thoughts away and that sort of thing. That's kind of how I approach it. And diet is a huge thing too. You know, staying plenty hydrated, all these things fit, you know, for with my approach.
Great. Thank you, Glenn. We're just about at time. I do have a hard stop, unfortunately. We maybe have time for one more quick question. Rick?
I wanted to say thank you, Glenn. I am inspired. I am mostly through your book. I've started using Dr. Lamont, and I am currently taking a lot of supplements, as Robert was so kind, because I read Starve Cancer and I like, oh, this is great. And it was, I thought, somewhat incomprehensible list of, you know, there's just like in chapter 22, there's a mention of this and it could be good for that. And then Robert gave me a little roadmap of supplements to take. And I'm not so smart on why. I just said, oh, here's the roadmap. And I went on Amazon and ordered a bunch of supplements. So I think Dr. Lamont will help tune me on that.
Sure.
I also wanted to mention, I'm such a big proponent because I worked at Amgen for 17 years in oncology, therapeutic drug development and research. And I realized how little we could do with a drug or a pill alone. And it's incumbent upon us to do our share. The doctor's not going to help us 100%. I've been intermittent fasting for about 4 Months. And anyway, I want to hire you, Glenn. I think you're awesome. I'd like to have Dr. Lamont and you in my corner. And I got to say thank you.
Well, thank you. I mean, I
Yeah, I
appreciate the
second that.
opportunity to
Thank you.
connect with you folks. And as I'm thinking more about these different agents that seem to align with the CLL and prostate that we've discussed, and I know we're kind of at the end of our time here, but a lot of these agents are anti-inflammatory, you know, whether it's the fish oil, the turmeric, and the green tea, and they're really anti-inflammatory. And so living an anti-inflammatory lifestyle through diet, through well-placed supplementation, sorry about that, is a good thing to focus on.
And I wanted to mention, John, thank you so much. I know you through Nick, right?
Yeah, you actually came out, we met at Urieta Genomics. So you came out to the lab, we bridged your daughter and we were talking about doing specific testing, but yeah, met originally through Nick. And,
Oh,
and Glenn, you hit it right on the head. This was, I just love your approach to it. And it's you're just your journey of learning, because you're humble, you just, it's real good to open up and really, I appreciate this. It was great talk. And you hit on the head. And anti-inflammatory really becomes what I find personally, the thing that helps me the most with, I've got a ton of just regular aches and pains from just, you know, using my body wrestling for 15 years. And that does it.
Thank you, Glenn. Thank you so much. Your story is inspiring. Thank you for the information. Thank you, John, for your generous offer. And thank you, everyone, for being on the call. This is what we intend to be the first of a series, so look for more. And thank you so much, everybody.
Take care.
Thanks,
Take
guys.
care.
Bye.